So I wanted to talk to you today about diabetes and feet and the important stuff that you need to know about them. I'm not going to give you facts and figures around diabetes and feet, just to say that there's an increasing problem with diabetes and the number of people being diagnosed with diabetes. And one of the complications you can have with diabetes is that you can develop foot-related problems, and there's therefore an increase in the number of foot-related problems. Those foot-related problems can lead on to ulceration, infection and gangrene. They can lead to amputation or even death, and there are strong correlations between people who've had ulceration and their longevity or mortality. So it's really important to get to grip with diabetes and feet. One of the common problems that can happen with diabetes and feet is it can affect the nerves in your feet, but it can also affect your skin, your soft tissues and your bone and your blood vessels. Basically anything can go wrong as a result of diabetes in your feet. But as I said, one of the most common is when it affects your nerves and your ability to feel when things are going wrong with your feet. So it's important to check your feet regularly with your eyes. You're looking for anything cut, bruised, swollen, festered, weeping or inflamed. And if you do spot something and it doesn't clear up in a couple of days, get in touch with your doctor or your nurse or your podiatrist or your foot specialist or your foot health care professional in order to get it checked out. If you end up with a diabetic foot problem, then it doesn't mean that it's going to definitely lead on to ulceration and infection or gangrene. Many foot problems can be dealt with very easily and resolved before they become more of an issue. However, one key indicator for us to know what the likelihood is of you developing a more serious diabetic foot complication is your diabetic foot risk status. So when you have your diabetic foot assessment, which you should have at least once a year, you want to know at the end of it what your foot risk level is. It will either be low, moderate or high. And depending on which tier you are in there will actually dictate the level of care that is required to look after your feet. So make sure whoever is carrying out your diabetic foot check each year, make sure they tell you what your foot risk level is. That way you can follow the most appropriate advice and receive the most appropriate care to prevent problems. If you've got any further queries with regard to diabetes and feet, there's lots of resources online to help you, lots of advice sheets. But the key thing for me is making sure that you keep your feet protected. So that's looking inside your shoes and socks, making sure there's nothing in them that could damage them. Don't toast your feet in front of the fire to warm them up. Don't use strong acids or vigorous implements to try and care for your feet. Use safe products, using soft, gentle foot files and using urea-based foot creams. They're nothing harsh, and wearing shoes that fit properly and are relatively soft on your feet so they don't cause any rubbing. Hope you found this information useful, and please like and subscribe our YouTube channel for when we post any more updates. Thank you.